How to exercise to relieve back pain. Subscribe and activate the bell to be notified as soon we upload a new video. Steps 1. Start a walking regimen. 1. Talk to your doctor. In particular, if you have back pain due to an acute injury, you should obtain permission from your doctor before beginning any exercise program. Your doctor can advise you on the types of exercise that would benefit you based on your specific injury. If you haven't been exercising for an extended period of time, you may also want to have a full physique to make sure you're good enough to start an exercise program. Your doctor can also advise you on various conditioning exercises in addition to regular walking, which may be beneficial to you. If your doctor gives you limits, follow them carefully, and don't push yourself beyond those limits without telling your doctor that you are ready to go further. There may be other risks associated with more strenuous exercise. 2. Start with a 5-minute walk. Walking increases circulation in the muscles and releases endorphins that reduce the sensation of pain. You exercise your entire body, including the muscles around your back, making it a great way to train your muscles when you start regular physical activity. To get into the habit of exercising and being physically active, start your diet by walking for 5 minutes a day. Try to walk at the same time every day so that activity becomes part of your routine. Ideally, you should walk on relatively flat paved surfaces. You can move to hills or unpaved trails later. If you are new to exercise or are recovering from a serious injury or after surgery, it is important to start slowly so as not to overload your body and expose yourself to another injury. Invest in a pair of supportive walking shoes, even if you only walk for 5 minutes a day to get started. Be aware that you may experience muscle pain, especially if you start a physical activity after being relatively sedentary. Maintain good posture when walking. Tuck your pelvis, contract your abdominal muscles and align your neck, shoulders, and hips. 3. Gradually increase the length of your walk. Once you can walk 5 minutes a day, add a minute or 2 to your walk each week. Adding time slowly gives your muscles time to adjust so that you can gradually develop strength without risking injury or fatigue. For example, you can walk 5 minutes a day for a week. During your second week, you can increase your steps to 7 minutes and 10 minutes in the third week. Keep adding the time until you walk at least 20 to 30 minutes a day. Once you get to the point of walking 20 or 30 minutes a day, the daily walk is not strictly necessary, unless you are into the routine and want to keep it as part of your day. Walking is a low-impact activity that is perfectly safe to do every day if you enjoy it. If you were athletic or regularly engaged in physical activity prior to an injury, you don't necessarily have to start as slowly as someone who previously led a sedentary lifestyle. You can also increase the length of your walk faster. 4. Alternate the walk with other aerobic exercises. Once you've established a regular walking routine of at least 30 minutes a day, 3 or 4 days a week, you may want to incorporate other aerobic activities so you don't get bored. Jogging or running is high-impact activities, so you may want to talk to your doctor again before going from walking to running. However, there are a number of low-impact aerobic activities that you can alternate with your walk for a small variety. For example, you might consider doing 1 or 2 sessions per week on an elliptical exerciser or step machine. If you have access to a pool, you may also consider swimming or water therapy. The buoyancy of the water makes swimming a low-impact aerobic activity that is great for your back. 5. Exercise for 30 minutes 3 times a week. Ultimately, your goal should be to do aerobic or cardiovascular exercise continuously for at least 30 minutes. Once at this level, maintaining the same routine will gradually decrease back pain. Only this. Steps 2. Strengthen your back. 1. Get a physical therapy prescription. If you don't know how to train with proper body mechanics, a physical therapist can help you devise a plan for you and check your shape to make sure you're doing the exercises correctly. Your doctor may prescribe several weeks of physical therapy. Check with your health insurance company to find out how many physical therapy sessions are covered by your insurance. Your physical therapist can also teach you how to maintain good posture and use various ergonomic techniques to strengthen your back and reduce the impact of office tasks that require you to sit for long periods of time. During your first physical therapy appointment, your physical therapist will give you specific exercises designed to strengthen your back, focusing on the reality that you have been specifically injured or are causing back pain. Follow your physical therapist's recommendations carefully. If you want to do other exercises or stretches, talk to your physical therapist so they can include them in your treatment plan if they see a benefit. 2. Use the McKenzie method for low back pain. Many physical therapists use the McKenzie method to treat acute low back pain, although patients with chronic back pain may also find some relief with this approach. To begin this treatment, you must first perform a series of movements with your physical therapist, who will evaluate your response and use this information to classify your injury. On the basis of the final evaluation and classification, your physical therapist will develop for you a personalized exercise program specially designed to reduce your pain over time. The goal of treatment is to gradually remove pain from the back and extremities. Therefore, if extension movements cause back pain, you will be prescribed a sequence of exercises that will begin by lying on the floor. On the other hand, if you have more back pain when flexing, the exercises prescribed by your physical therapist will include more flexible exercises while sitting or standing. 3. Strengthen your body with an exercise ball. An exercise or stability ball can be helpful in strengthening the muscles of the back and trunk, as well as improving balance and stability. These exercises also offer a full body strength training session. For example, you can do a front strike, which begins by lying face down on the ball. Advance your hands as far as possible, rolling the exercise ball underneath you toward your feet. Roll the ball up to your thighs, keeping your heart busy. Then return your hands to the starting position and repeat 3 to 5 times. You can do the same backward exercise, where you sit on the ball and move your feet away from the ball. Finally, you will be on your back with the ball under your shoulders. Other ball exercises include inverted crunches and inverted extensions, or a combination of these two movements in one exercise. Exercising with a ball can be difficult, especially if you have never used one before. Instead of trying to start a new diet with an exercise ball on your own, you'll get better results if you work with your physical therapist or a certified sports coach who has worked with people with back pain. 4. Try mild Pilates classes. Pilates increases your stability and further strengthens your core strength, which can ease back pain. Consult your doctor before starting a Pilates class and be sure to talk to your instructor about your back pain so he can make the appropriate changes for you. Since good posture is one of the most important aspects of Pilates, many postures and movements focus on strengthening the heart and back muscles. The slow and smooth movements of Pilates make it a good weight training program to add to your general exercise routine. Pilates also focuses on non-stress neutral alignment and movements of the spine and back, which can help you develop habits for maintaining a strong and healthy back. Your doctor or physical therapist may recommend a private Pilates class in your area that is suitable for people with back pain. 5. Go to strength training with weights. Basic weight training exercises with light hand weights help you build strength in your back muscles. Over time, it will get stronger and reduce back pain. For example, you can add the reverse fly, which strengthens the upper back and shoulder muscles. Stand up straight with your knees slightly bent and your feet shoulder width apart. Hold a weight in each hand with your palms facing each other. Lean forward at the waist, keeping your back straight. Raise the weights to the sides with your elbows bent, squeezing your shoulder blades, then release them. Another strength training exercise for the back and shoulder muscles is the curved row. Stand up straight with your feet hip width apart and bend your hips, not your waist, until the weight in each hand is on your knees. While keeping your upper arms and elbows next to your ribs, pull the weights across your chest. Squeeze the shoulder blades while pulling, then slowly return to the starting position. Develop a strength training program with 3 or 4 exercises that target your back and shoulders, doing 2 or 3 sets of 5 to 10 repetitions each exercise. Gradually increase the number of repetitions or sets you perform until you can finish your routine without fatigue. Then you are ready to increase the weight you use. If you have a non-muscle related spinal injury, talk to your doctor before adding weight training to your exercise program. Steps 3. Work with your doctor or physical therapist. 1. In particular, if your back pain is related to an acute injury, you should not attempt to stretch without first consulting your doctor and working with your physical therapist to ensure that it no longer hurts. When you start a stretching routine, be sure to wear comfortable clothing that doesn't hold you down or restrict your range of motion. Keep in mind that stretching doesn't have to be painful. Move as comfortably as possible, don't force your body to go any further or you could cause additional stress or injury. Make sure you are warm before starting a stretching routine. 2. Stretch from knee to chest. Stretching from the knee to the chest is ideal to help align the pelvis and stretch the muscles of the lower back. You must hold each position for about 20 seconds and repeat these stretches at least 3 times for each leg. To stretch from knee to chest, you must lie on your back, with your toes pointing up. Slowly bend your right knee, pulling your leg toward your chest. Wrap your arms around your leg and hold it close to you, then let go and do the same movement with your left leg. 3. Try twisting your knee down. This stretch not only stretches the muscles that run parallel to the spine but also strengthens the core muscles, especially the abdominals. Your physical therapist may prescribe this stretch or something similar if you have had a spinal injury. You will also begin this stretch stretched out on your back, with your legs stretched out. Bend your right knee and cross your right leg over the left side of your body. Pull it out until you feel a slight stretch in your back, keeping your heart busy. After holding the stretch for about 20 seconds, slowly release the leg to the starting position, then do the same for the left leg. Repeat the stretch at least 3 times with each leg. 4. Use yoga poses and stretches. Even if you have not had an acute back injury, you can still experience lower back pain, especially if you have an office job that requires sitting behind a desk for hours. Yoga poses can help alleviate this type of back pain. You don't need to attend a yoga class to learn some basic postures to ease back pain. However, if you have never practiced yoga before, you may want to attend at least one class so that the instructor can help you and make sure you are doing the poses correctly. While doing your yoga poses, train yourself to breathe deeply through your nose and exhale through your mouth. In yoga, breathing is as important as postures, if not more important. A yoga pose that is good for back pain is twisting on both knees. Lying on your back, bend your knees against your chest. Your arms should extend to your side in a T shape. Exhale and lower your knees to the floor on the right side. Make sure that both shoulders are firmly pressed against the mat. Bring your knees to the center, then go to the other side. Another yoga pose you can do to strengthen your back and relieve back pain is the Sphinx. Lie on your stomach with your upper body resting on your forearms. Your palms should be flat against the floor, your elbows at a right angle. Press the top of your feet and palms down and push your pelvic bone forward. You will feel it in the lower back, but focus on your breathing and breathe deeply. Hold for 1 to 3 minutes, then relax on the floor. 5. Include sitting stretches. Seated stretches, such as the piriformis, can help relieve back pain, especially when you have sciatica that radiates down your legs. The piriformis muscle is located in the buttocks and can compress the sciatic nerve, causing pain in the lower back that radiates to the legs. Relieve this type of pain by sitting on the floor with your right back, then cross your left leg to the right so that your left foot is next to your right thigh. You can tuck your right leg under your buttocks. Support your left knee with your right arm, extending your left arm to your side to rest on the floor. Relax and breathe in the stretch, holding it for about 20 seconds before alternating sides. 6. Roll your shoulders and squeeze your shoulder blades onto your desk. Even after returning to work, you can periodically stretch your back while sitting at your desk. These and other exercises can relieve back pain if you sit for long hours. Create a mini routine to stretch at work throughout the day. Arch your back 5 to 10 times, then do 10 shoulder turns and 10 shoulder blade presses. It can also incorporate stretches or head and neck rollers. If you sit for long periods of time, you should do your mini routine 2 to 3 times a day. You should also make an effort to get up and move for a few minutes after sitting for about an hour. For example, you can get up every time you answer the phone. Subscribe and activate the bell to be notified as soon we upload a new video.